All right, Sarah. I think we're good to go. I'm ready when you're ready.
Great. Well, good morning, everyone. Welcome to this morning's YouthLead Acts of Good webinar on education and voluntary reproductive healthcare, a panacea for positive youth and community development. My name is Sarah Sladen. I am the Senior Youth Engagement Advisor for YP2LE and am part of a broader team with Youth Power 2 and YouthLead. Just so give you a sense of who our team is, we also have Christy Olenek, who is our technical director. We have Christy Scott, our director of Youth Power 2 Learning and Evaluation. Maria Brindlemeyer, who is our knowledge management specialist for YP2LE. Rachel Stepka is part of our broader communications team. Ikenna Anidike is an Atlas Core Fellow on our team and Knowledge Management and Communications Fellow, as well as Ephraim Bekele, who is our Youth Engagement Fellow for YP2LE and also an Atlas Core Fellow. And of course, Abulaji, who has put this webinar together today with our YouthLead Ambassadors, who is also a Knowledge Management and Communications and Atlas Core Fellow. So we're a small team, but a big team. And everyone here has been working in support of advancing positive youth development and growing the YouthLead platform. If you're not familiar with the Youth Power Project, I want to offer you a little bit of background about who we are. YouthLead is a global network of more than 7,000 young changemakers from around the world that started in 2018 as an activity under the USAID-funded Youth Power Learning. That project continues today under its second phase, Youth Power 2 Learning and Evaluation, or YP2LE for short. YP2LE is focused on sharing knowledge, learning, tools, best practices, and what works in positive youth development. The definition of positive youth development, or PUID for short, includes 4 components. These are assets, agency, the ability to contribute, and an enabling environment. In other words, we believe that youth have assets, that they should have the ability to leverage these assets through agency, as well as the ability to contribute to positive change for themselves and their communities. And to do this, youth should be surrounded by an enabling environment that supports them. The vision for YouthLead is to serve as a global hub for young changemakers ages 15 to 35 that enables youth to maximize their impact through networking, accessing information and resources, funding opportunities, learning events, and mentoring. We bring together youth from different networks from around the world so that you can connect, get inspired, and learn from one another while accessing all of the resources and information on the site. The site is available in English and Spanish and will soon be available in French. It also has Google Translate on every page of the site. Among the activities we've been heading up this year includes our response to the COVID-19 pandemic, which we know has impacted everyone. You can help lead the way in responding to the impacts of the virus in your community by joining our YouthLead Acts of Good campaign. We know young people have the passion, ideas, dedication, and motivation to help mobilize quickly in their communities, and we want to help highlight the role of young people as leaders in the world. If you're between the ages of 18 and 35, you can take the pledge between now and July 15th. Once you've made your pledge, we'll send you a digital badge for your social media or YouthLead profile. You can also join the YouthLead network now if you don't have one. We'll be highlighting the stories of young people committing acts of service and good in their communities in response to COVID-19 between now and mid-July. We invite you to learn more about this campaign on youthlead.org. We've received some really amazing stories so far. The last thing I want to share is that we are very pleased to announce the launch of our brand new YP2LE Youth Advisory Group. This is a 7-member group made up of young changemakers from Bolivia, Kenya, Lesotho, Mauritius, Nepal, Palestine, and Uganda. And we received nearly 1,300 applications that showcase the talents, leadership, and commitment of young people in our YouthLead network. The newly selected YAG will play a vital role in ensuring that meaningful youth engagement and leadership occurs across all YP2LE tasks and related activities. This includes research, communications and advocacy, mentoring, capacity, learning networks, and the youthpower.org and youthlead.org platforms. Our members of the YAG will provide strategic input, support, and amplify youth voices, offer recommendations, advise us on the development and dissemination of learning products for youth, and ensure inclusive approaches for all young people. We invite you to go to youthlead.org to learn more about the YAG and explore their profiles. They're really an amazing group of young people, and we're excited to incorporate youth leadership and engagement at every level of the project. So with that, I'm going to turn it back over to Abulaji and to this morning's speakers, our YouthLead Ambassadors, and thank you again for joining us.
Thank you very much, Sarah, for starting us off on this webinar. Good morning, good afternoon, good evening, everyone. Thank you all for joining us again on the YouthLead Act of Good webinar series. Today we'll be exploring the topic, Education and Voluntary Reproductive Health Care, a Panacea for Positive Youth and Community Engagement. And we're super excited really to have two great young change makers, YouthLead Ambassador from Albania, Hanisa, and then we have our YouthLead Ambassador from Burkina Faso, Seydou. So just to give us a bit of background behind on the bios of our speakers today, Seydou is a young change maker and he works as a reproductive health advocate, advocating for integration of comprehensive reproductive health education in schools and for the creation of youth-friendly services at the community level in his community. Seydou holds a master's degree in governance and regional integration at the Pan-African University Institute of Governance, Humanities and Social Sciences. He's done really awesome work. He's also a researcher and an advocacy associate with the International Youth Alliance for Family Planning, IYAFP, and also works on empowering evidence-driven advocacy, EEAD project in Burkina Faso. So you all will be hearing from Seydou, who's going to take a deep delve into this webinar topic today. And then also Seydou is also joined by our YouthLead Ambassador, Anissa, who is an English teacher at a junior high school. Anissa has more than 6 years experience advocating for children and the community in Albania, and that's in Southeastern Europe. Anissa supports international exchange programs between schools and students in our country and around the world. She focuses on creative programs and projects that enhance intercultural collaboration and has a passion for education. Anissa believes that education is a basis by which informed and successful family and reproductive health goals can be achieved. On this note, I would like to call on Seydou. Seydou, I hope I was able to introduce you well, but I would like you to just tell us a bit about your background, and then you can start us off into this webinar.
Okay, thank you very much, Abolaji, and thank you very much all the team of YouthLead team for the wonderful job that you have been doing. I also want to greet and thank all the participants here who take the time to participate in this webinar. As you were saying, I'm Seydou Sawadogo from Burkina Faso, YouthLead Ambassador. I'm a research and advocacy associate with International Youth Alliance for Family Planning to conduct either project here in Burkina Faso. Either is empowering evidence-driven advocacy. The main objective of this project is to assess gaps in implementation of policies that support youth-friendly care, and its specific aims are first, to identify strengths and gaps in the implementation of family planning care of youth, and that the factors that contributing to these strengths and gaps. The second aim is to ensure that perspectives of youth aged 15 to 24 who access family planning care are integrated into analysis of implementation of the strength and the gaps. The third aim is to identify programmatic actions that the government and its partner can take to improve the implementation of existing policies that improve that support youth-friendly care. And the last one is to increase youth advocates' capacity to measure policy implementation. And either is a project conducted by Population Reference Bureau and International Youth Alliance for Family Planning. And this project is implemented in 5 countries across Africa, Nigeria, Uganda, Kenya, Ethiopia, and of course, Burkina Faso. And I'm also a co-founder of YouthLead organization, which is called Pan-African Center Initiative for Sahel, to promote peace and development in Sahel. We need peace and Sahel peace and development in Sahel right now. that's a little bit about myself. This picture that you are seeing here, it's when I was presenting a comprehensive sexuality education in front of people. We were advocating to integrate it into school curriculums. So that's a background of me. Now we can go to a next slide. Okay. Okay, thank you very much. This is the content of what we are going to talk about today. Today we are going to talk about voluntary family planning and reproductive health care, its relations to COVID-19, youth spaces, health, education, and community development. We are ending our presentation by giving few recommendations and resources that can help youth and participants to go and look for more information. But specifically in this webinar, we are using voluntary family planning and reproductive health care instead of sexual and reproductive health services. I just wanted to mention it and let people know what we are going to use. Don't be confused. Okay, next slide, please. Okay, in this slide, we are going to talk about a little bit about the context of where we are. And the statistics from World Health Organization says that about 16 million girls aged 15 to 19 and 1 million girls aged 10 to 14 give birth each year. And what we can say in this statistics is that there are some girls that the pregnancies have been planned, but there are others that the pregnancy may not be planned. And in this specific webinar, we are going to focus mainly on those who the pregnancy have not been planned. And 23 million adolescents aged 15 to 19 years contraception and are at risk of intended pregnancy. Not only on intended pregnancy, but they are also at risk of the health, the education that we are going to see in the following slides. Next slide, please. Okay, before coming to barriers that young people face while they are looking for sexual and reproductive health care, let me mention 5 dimensions that World Health Organization has identified to define what is youth-friendly care in terms of voluntary family planning and reproductive health care. The first one is equitable. It means that all youth and adolescents are able to obtain the health care that is available. Here is there should be a selected group, no discrimination. Everyone should be able to obtain the available health care. The second dimension is accessible. It means that all youth and adolescents are able to obtain the health care that is available. Here we can talk about affordable fees, since young people do not have incomes like that, and opening hours. Maybe health centers should be open maybe 24-hour over 24, so that young people can access family planning, reproductive health care at any time. The third one is acceptable. It means that all youth and adolescents are willing to obtain the health care that is available. Here, the health care should meet youth and adolescent expectation. And the next one, we are going to talk about appropriate. It means that the right health care that is provided should meet youth needs. And the last one is effective. Voluntary family planning and reproductive health care should be effective. It means that the right health care is provided in the right way to make a positive contribution to youth and adolescent health These are the 5 dimensions that World Health Organization has identified to define what is youth-friendly care in terms of voluntary family planning and reproductive health care. Okay, next slide, please. Okay, here we are going to talk about social and gender norms as barrier that you face while they are looking for voluntary family planning and reproductive health care. Sexuality is a taboo in many societies. People they talk less about sexuality at schools, in the society, in the community. For instance, when you talk to elders here in Burkina Faso, they use some techniques to talk about sexuality with their children that we are not using right now. The technique is what? When you have a child or a younger brother, to talk sexuality to him, because it's less embarrassing than if it's yourself. And if a child is a girl, you can ask your younger sister to talk to her so that they can communicate easily. Because here in our society, talking about sexuality directly with your parents is not easy. Yeah, and we are in patriarchal societies. In our society, mainly in developing countries or in Africa, women do not have this strong power to make sometimes decisions. There are some husbands who say that the wife should not use maybe contraception or look for family planning care. And stigmatization is a key element, because while young people are looking for voluntary family planning and reproductive health care, sometimes they are stigmatized, saying that you shouldn't use it, you are too young to use this. And what we can add is religion and traditional beliefs sometimes are barriers to young people when they are looking for reproductive health care, because there are some religion leaders, they say that yeah, you are not married. If you are not married, you are not allowed to have sex. And why are you looking for contraception? So those kind of beliefs are a barrier in terms of religion that can prevent young people to look for reproductive health care. And the next one is communication. As I was saying, we are not communicating enough. Even at school, sometimes when you talk to young people, they are only based on rumors about sexuality or contraception. So they do not have enough information about contraception, and they just look for maybe through internet or asking their peers. Sometimes it's not right information. So communication is a barrier too. Next slide. Okay, here we can talk about challenges that you face in accessing voluntary family planning and reproductive health care. Here we are going to talk about how health provider they can be a barrier to youth. Health providers sometimes they lack skills in terms of communication, in terms of respectful manner, youth privacy and confidentiality. Sometimes there are some health workers, they are not able to guarantee youth privacy and confidentiality. And sometimes when you talk to young people, there are some young people, they travel too far to look for voluntary family planning and reproductive health care, because they don't want to go a place near their home. Maybe they can find someone there that may know their family. So they go far and look for the services instead, then they don't want to meet the person that they know. That's why sometimes they go far to look for this care. And counseling training, they are there are some health providers, they are not well trained to counsel young people. Sometimes when you go to look for healthcare, sometimes they are a manner that they are telling you, a manner that they are asking you questions. It's sometimes it's embarrassing, and this can maybe limit youth access to voluntary family planning and reproductive health care. And the last one is providers and staff behavior. Their behavior sometimes it's not friendly. Young people go to ask for services, but the way they are welcoming them is not friendly. If you go somewhere and you are not welcome, next time you will not go there. Then this one is also a barrier that young people face while they are looking for voluntary family planning and reproductive health care. Next one. Okay, here we are going to talk about health facilities programming characteristics, which can limit young people access to voluntary family planning and reproductive health care. Young people like convenient location. They like adequate space, comfortable surrounding. Young people like to go to a center where they can find poster, they can find television, they can find maybe Wi-Fi so that they can connect themselves. But there's many health centers, especially in developing countries, which do not have these things. So it does not encourage young people to go and look for voluntary family planning and reproductive health care. And the next one is youth involvement in policies implementation. Yeah, we can hear everywhere that each program they are talking about youth, but in reality, youth are not very well involved in policies implementation. Maybe they can invite them to workshop, but youth do not have this power to control certain policies. So this, because sometimes they say that you cannot define something for someone if he's not around. So youth should be involved very well in policies implementation. The next one is affordable fees. We know that many young people do not have incomes. They do not have revenue. Even if there are some government who subsidize voluntary family planning and reproductive health care, it's still expensive for those who do not have money. If you don't work, you don't have money to. So affordable fees is a cost of reproductive health care is a barrier when young people are looking for this care. And the next one is providing free training and online training. This training is just to empower young people to participate and to know what are their rights in terms of voluntary family planning and reproductive health care. And we are talking about online training because we are in this pandemic period. Sometimes it's very difficult to have people like that. So we can encourage people to do online training and get more information about this topic. And the next one, youth need also safe space for youth, both male and female. What I want to talk here is about parent engagement. I was mentioning it, but here I'm going to focus mainly on male engagement. Here in Burkina Faso, there is a project implemented by UNFPA and its partner, what is called School of Husband. This project aims mainly to empower people, male, to promote sexuality, to promote voluntary family planning and reproductive health care in the community, to be a model and to be a leader in their respective community. I think this project is wonderful maybe some people can look for it and have more information about male engagement in terms of promotion of voluntary family planning and reproductive health care. Next slide. Okay, thank you. We cannot talk about access in this period without talking about the impact of COVID-19 in terms of access of voluntary and voluntary family planning and reproductive health care. The first impact.
Hi, Sid. It looks like we lost you in between. Okay, looks like you're back now.
Okay, I'm there. Okay, I'm there.
Yeah, all right. Please go ahead.
Okay. Limited access to voluntary family planning and reproductive health care by young people due to countries lockdown. People are not allowed to go outside. If you are not allowed to go outside, it is very difficult to go to health center to go to look for this care. And the next one is shortage of voluntary family planning and reproductive health care supply due to quarantine. This is mainly for developing countries. In developing countries, we are importing almost everything. So this care or this supply may not be sufficient to this during this pandemic period. And COVID-19 also can have we have seen that there are some health centers and they have been closed. They have been closed or provide a minimum care. Or this one can impact young people access to voluntary family planning care. And I just want to give a few statistics about this. What UNFPA have said. It said that it is said that in 114 developing countries, if the lockdown takes 6 months, 47 million of women will not be able to access contraception. And this can lead to 7 million unintended pregnancies. So these statistics are I think that it's high. And it's also said that if this situation continue, we can see more than 31 million cases of gender-based violence. So we can see that COVID-19 has increased the cases of gender-based violence around the world. Next slide, please. Okay, and what can we do in this pandemic period? What we can do is we have to support prevention of harmful practices. We can report them to where it should be reported. We can also ensure equitable access to provide care for all groups. Yeah, because there are some people due to COVID-19, they are becoming more and more vulnerable. So we need to ensure access to protect patient privacy and confidentiality. We need to protect them and we need to guarantee them in order to help young people access voluntary family planning and reproductive health care. Okay, next slide. Okay, before giving the floor to my peer ambassador, let me just highlight few impact of voluntary family planning and on youth health. The first one is to reduce sexuality transmitted infections, HIV. It can also reduce using violence to resolve conflict, and it can also reduce having multiple sexual partners. and it can also reduce unwanted pregnancies, promote gender equality, to reduce increased risk of morbidity and maternal mortality. This is the impact of voluntary family planning and reproductive health care on youth health. I think it's not exhaustive, but just few, and it shows that it is very important to promote voluntary family planning and reproductive health care. And I'm going to give the floor to Aniza, who is going to continue the presentation with the following slides. Thank you.
Hi, everyone. Hoping that you are doing well. How can voluntary family planning, reproductive health and care impact positive youth development? In order to achieve the vision of a healthier, productive, and engaged youth, positive youth development programs, practices, and policies, they must work together with youth to improve their assets, agency, contribution, and enabling environment. When we talk about assets, we mean that youth have the necessary resources, skills, and competencies to achieve desired outcomes they need, such as training, formal education, interpersonal skills, higher order thinking skills, academic achievement, etc. When we talk about agency, we understand that youth perceive and have the ability to employ their assets and aspirations to make or influence their own decisions about their lives and even set their own goals, as well as to act upon those decisions in order to achieve what they really want. When we talk about contribution, youth are engaged as a source of change for their own or for their community's positive development. Enabling environment. Youth are surrounded by an environment that develops and supports their assets, agencies, access to care and opportunities, and strengthens their ability to avoid risk and to stay safe, secure, and also protected and live without fear of violence or retribution. An enabling environment encourages and also recognizes youth while promoting their social and emotional competence to thrive. The term itself, environment, should be interpreted broadly and includes social, and by social I mean relationships with peer and adults. Normative, such as attitudes, norms, and beliefs. Structural, such as laws, policies, program services, and systems. And also physical, such as safe and supportive spaces. Next slide, please. Voluntary family planning, reproductive health and care, and youth education. How do they connect together? It's very essential that we must create productive opportunities for young people to ensure their good health, including their mental and well-being. Also, adopting innovative models of care contribute to better care, improved health outcomes, and lower costs. Then, quality education provides effective and innovative models of care for a long time, such as digital solutions, and also prevent diversion of resources. Ensure the good health or vulnerable communities and address their needs. We know that vulnerable populations are groups and communities at a higher risk for poor health as a result of the barriers they experience due to economic, political, and environmental resources, as well as limitations due to illnesses or disabilities. Here we are helping them move forward and also have clear information about where and how to access better health care. And also strengthen private sector actors. Alongside private sector actors, we must shore up and strengthen the national and regional supply chain to make reproductive health medicine and supplies more accessible. Some forms of private sector involvement. We have payers or financiers, which mean private health insurance companies and charities. Charities works better with low-income communities. Some providers, we have private hospitals and clinics, private doctors and nurses, civil society organizations, and charities. And some suppliers, we have pharmaceutical companies and suppliers of medical equipment. Next one, please. Voluntary family planning, reproductive health and care, and youth education. Education relates to voluntary family planning, reproductive health and care issues in various ways. Four interactions are particularly recognized. First of all, schools and other non-formal learning environments are sites where some of the most troubling incidents related to sexuality takes place. For example, sexual abuse. Second, several voluntary family planning, reproductive health and care issues have negative bearings on the education system, such as early marriages or unwanted pregnancies. For instance, result in absenteeism or drops out at school. Third, education has direct impact or several indicators on voluntary family planning, reproductive health and care. For example, the numbers of years of schooling of women closely relates to maternal and child mortality rates and to the number of children they have. In addition, when girls attend schooling, the chances of them getting pregnant or marrying at an early age is lower compared to those who are out of school. Education in these cases is really important. And finally, education can help to respond to these challenges and to promote voluntary family planning, reproductive health and care through socialization, sexuality education programs, or counseling programs. Next one, please. What's the impact of voluntary family planning, reproductive health and care on education? As long as we have a lack of good quality education in voluntary family planning, reproductive health and care, it may lead to lack of professional competence, which means no professional trainers or youth workers or teachers. Continuing professional development is important because it ensures you continue to be competent in your profession. It is an ongoing process and continues throughout the professional career, so you can maintain professional knowledge and skills at the level required to ensure that the person receives competent professional care based on current developments in practice, legislation, and techniques, and act diligently and in accordance with applicable technical care offered. It also helps young people to empower themselves and also have a voice to be heard. Sometimes youth has very problems, so their voice can be heard. Voluntary family planning, reproductive health and care is a key element when you talk about youth autonomy, so they can be on their own when you talk about maintaining themselves economically, be independent, and have the right to go to school or university or work. Different approaches according to society's content. Different countries have different societies and different ways of perceptions when you talk about education and voluntary family planning, reproductive health and care. It's okay to be different, but it's not okay when these approaches are against human rights. They must be changed in order to give everyone access to education and voluntary family planning, reproductive health and care. Next one, please. How can voluntary family planning, reproductive health and care impact community development? We have some challenges and some solutions. First, challenges. We have lack of healthcare, information, low-income economic development, which is one of the biggest issues that communities and most of the world face today, and its effects has increased due to COVID-19, mostly. Increased community literacy in human rights which means build or strengthen community capacity in monitoring and accountability and ensure robust means of redress for violations of rights. Establish an active process of engagement between the community and health system through negotiations to improve outcomes and to ensure that rights are respected, protected, and fulfilled. We should also educate the community on mechanisms to ensure a really high quality of care and voluntary informed decision-making. Ensure improved health outcomes through the monitoring of provider performance, the quality of care and facilities, and the availability of commodities. No evaluation on health impact assessment. What does it mean? Health impact assessment is a rapidly growing field that can bring together scientific data, health expertise, and public input to identify the potential effect on public health of proposed laws, regulations, projects, policies, and programs. Federal, state, and local organizations are increasingly using health impact assessment to help community development professionals consider public health implications when making decisions. Health impact assessments broadly take into account environmental, social, and economic factors to evaluate the potential impacts of a decision on the health and well-being of the whole community, including the full range of positive and negative impacts. It employs a variety of data resources, including qualitative and quantitative analysis and input from stakeholders. Also to identify health concerns and determine the effect on the local population, especially high-risk groups, such as seniors, children, and low-income families. Finally, health impact assessments provide pragmatic, evidence-based recommendations about how to reduce risks, promote benefits, and monitor the health effects of the implemented decisions. This leads to community-driven care changes. We define being community-driven as putting people first, people being whoever makes us a community, current and potential customers, partners, investors, employees, colleagues, friends, family, etc. To be community-driven, you must define your own goals around you that you want to accomplish by your community members. So we are connected together and we are powerful enough to make the change we want. The negative consequences affect the whole community. Community-driven development programs operate on the principles of transparency, participation, accountability, and hence local capacity. Experience has shown that when we give clear and transparent rules, access to information, and appropriate technical and financial support, poor communities can effectively organize together to identify community priorities and address local problems by working in partnership with local governments and other institutions to deliver basic care. Identifying solutions. Integration of voluntary family planning, reproductive health and care interventions into the community health system. A missing piece for successful integration of voluntary family planning, reproductive health and care into the community health system is important, as it may help make the voluntary family planning, reproductive health care compatible with the local structures, and thus appropriate and accessible by youth and by the communities. While some countries have taken steps toward integrating voluntary family planning, reproductive health and care into the community health system, the pace of the integration process has been generally slow, and little consensus exists about the optional models of integration or about how best to achieve them, with the consequence that the term means different things to different stakeholders and takes a diversity of forms. This problem has been compounded by limited knowledge of the mechanism for delivering these voluntary family planning, reproductive health and care interventions, including the integration process and how to sustain changes triggered by the interventions. Thus, there have been increased calls for further research into the mechanism and contextual factors that support integration and sustainability of such interventions. A growing body of international guidance on the scale-up and sustainable implementation of community-based health interventions, such as interventions to strengthen voluntary family planning, reproductive health and care, recognizes the contribution of both formal health sector and community factors to the success of programs provided. However, community health systems remains insufficiently characterized. To enhance the success of such interventions, it is important to promote the better integration of community-based health interventions into formal and community aspects of the health system. National tracking systems, quality and quantity data gathered can improve health protection, help tackle health inequalities, improve health behavior, and assist to enabling local people to influence planning of local health. The basis of this benefit is the confidence in building the number of strength of our face-to-face social networks in our communities. And this leads to promoting voluntary family planning, reproductive health and care, and also strong will determination. Next slide, please. Community empowerment. Build, strengthen communities' capacity to advocate for available, accessible, acceptable, and high-quality healthcare. Also, foster advocacy to address social barriers to access, include barriers to reproductive health education, increase overall awareness and support for reproductive rights, gender equality, and information and access for young people. Also build awareness and support for the reproductive rights of vulnerable groups. Mobilize the community to advocate for reproductive health funding and on improved country content, and enabling environment for family planning access and use. Next one, please. Recommendations. Progress further towards securing and safeguarding voluntary family planning programs. How? Foster additional dialogue at the global and country levels to facilitate discussions around the critical issues of expanding access to family care, to family planning care, particularly to underserved population groups, and respecting, protecting, and fulfilling human rights. Develop guidance and tools to apply the framework in programming to facilitate its use at the country level and through donor support. Update and expand the reviewers of evidence and tools to ensure inclusion of all relevant material, so that programs have access to the most relevant and up-to-date information for programming. Identify a comprehensive set of indicators to support the framework, including for all the various levels at which family planning care programs function. Have the relevant Family Planning 2020 working group identify a comprehensive set of structural, process, and outcome indicators, then monitor and evaluate a rights-based approach to family planning care. Develop innovation in rights-based public health approaches and additional investment in interventions that are explicitly rights-based. Focus particularly on additional interventions to strengthen the individual empowerment, community participation, and capacity building. And we urge governments and donors to embrace and support voluntary family planning, reproductive health and care, human rights-based family planning programming with the support and engagement of civil society, and also hold programs accountable for respecting, protecting, and fulfilling human rights. Thank you for listening to me. And how can youth lead, in this case, peers help? You can be an ambassador of voluntary family planning, reproductive health and care in your respective communities or societies. Also, you can join the YouthLead platform and be a member there. So engage in platforms to share experience and information, and also engage with stakeholders through both face-to-face and online. And you can follow us even on Twitter. So we have some tools to help youth. You have the links there, like Youth Coalition, Advocates, YouthLead. I think that's for me. That's all from me.
All right.
Okay.
Thank you, Anissa. Thank you very much. Thank you, Seydou. Thank you, Anissa. It's been really interesting and to really hear your perspective and to share your knowledge. We do have quite a lot of questions from our audience, and I would also want to I want to call on Zeitwa Fabiano, who is also one of our YouthLead ambassadors, to ask a question. So Zeitwa, you have been given microphone rights, so you can unmute yourself and then ask your question.
All right, thank you very much. Thank you for a wonderful presentation. Very informative. I also work in the health sector, so it was very informative for me particularly. My question is about involving youth in advising policy. I've noted that we have made a lot of strides in terms of involving the youth, but usually we get youth who are from the urban areas and we leave out the ones who are in the rural areas. I find that the challenges in accessing health are different amongst these two populations. So what can you advise in terms of trying to involve the youth from the rural areas as well? Thank you.
Thank you very much, Zeitwa. I would like to call on Seydou. Seydou, would you want to go for this question?
Okay, thank you very much, Abolaji. And thank you, Aizitua. I think that I can pronounce it very well for the question. Yes, you are right. It's youth in urban area and rural area are not the same in terms of access of healthcare. But what we can do for youth in rural area is they should be organized in terms of networks. That if you go there to look for young people, it's easier to find them. And another one, especially during this pandemic period, what we can do is we know that it is very difficult to have access to internet so that they can advocate through online. But what we can see is through maybe simple messages, for instance, or passing through radio like that, or even television, that they can be organized and participate in the implementation of policies. And in terms of providing healthcare, we can organize by maybe through mobile health centers like that, because it's very difficult to find health centers in some rural area. But if it's mobile, they can go around and serve them and give healthcare before going. So I think that it's hard, but we can try to involve them in the policy implementation. I don't know if Anissa can add something else.
No, that's okay.
Thank you very much. All right, so we also have Brian with his hands up. Brian, you have microphone rights now and you're able to ask your question.
Okay, thank you so much, Abolaji. Thank you guys, Seydou and Anissa. Thank you so much for the wonderful presentation. It was so informative. So mine, I think isn't more of like a question. I think it's more of a comment. I mean, like, I think one of the things that for me I did some time ago was also working on the comprehensive sexuality education program. So it was basically a program that worked on the nexus between education and reproductive health, and you know, providing this information to learners so that, you know, people at the clinic can be more youth friendly, and you know, people at the teachers also can also expose such information to learners so that they know what constitutes of, you know, their health aspect in terms of abuse and all these things. So for me, one of the things that I also wanted also to suggest was, I know that a couple of years ago, for example, in Eastern and Southern Africa, UNESCO did this thing where it called an ASA commitment, which was like Eastern and Southern African commitment, which was a commitment that there would be a nexus between education and sexuality education. And basically what it meant was that education would be taught to learners, sexuality education would be taught to learners and through a coordinated system. So I would suggest also important that can be on our programmers of these things of healthcare providers not treating young people well, and also young people learning sexuality education through the guiding and counseling segment. So I think that's what I also just wanted to say, that I think that also can be also added like to the discussion. Thank you.
Thank you very much, Brian, for sharing your insights on some of these programs. All right, I would want to call, lastly, before handing to my co-host here, Ephraim, and I would like to call on Pire Adamo. Pire, you can go ahead and ask your question, and you've been given microphone rights.
Thank you so much. And I'm Pierre Adamo. I'm from the DRC, and I'm a part of the International Youth Alliance for Family Planning. My question is for both panelists. And the first one is to know what can be the contribution youth can make in order to reduce the risk associated with the COVID-19 and maintaining SRHR and FP services to their peers during this period. And another question, as I joined the live a little bit late, is to know what can be the best approach to reduce the increase of gender-based violence, as it was mentioned with the UN Women Report. Thank you so much.
Thank you very much, Pere. All right, Anissa, Seydou, you got two questions for you.
Okay.
Okay.
So we can start with Anissa, then Seydou can go ahead.
No, I think I can go on the second one.
Okay, good. Please go ahead.
So when we talk about gender-based, I think right now what is really important is that we can have like projects inside. For example, educate youth and children first. So we can have projects inside the school, or we can have clubs like gender clubs or health clubs, because sometimes it's very unusual to have this kind of clubs. So maybe we can have health clubs so the kids or children or youth or adolescents can include them, and then a teacher or even sometimes the school has senator or ambassador can talk about that. I think this can be a solution. And also create projects that involve gender-based things more. It could help, especially in countries that there are more taboos than in other countries.
Mm-hmm. Thank you very much, Anissa. Seydou, you wanted to go for the first question.
Oh, I'm not sure if I heard very well the first question because it was crashing. I don't know if it's possible to repeat it.
So the first question was, what contribution can youth make to reduce in reducing the risk associated with COVID-19 and maintaining reproductive health and family planning services to their peers during the period? So what contribution can youth make? Yeah.
Yeah, thank you very much for this question. I think that even if you have been doing a wonderful job, what youth can do to help their peers is what? For youth who have access to internet like that, they can create platforms, for instance, that they can share information through this pandemic, during this pandemic period. They can share information about sexuality, or if it's possible, they can do what we call e-commerce in terms of family planning care. If it's possible, they can go and sell or give a services to youth who are still at home and are not able to go outside. I don't know if it's in this way that you was asking.
Mm-hmm. Yes, yes. All right. Stay up. I think you basically addressed part of the questions actually, and I know we're running short of time. And Ephraim, I know we have some questions on Facebook also. So, do you want? Well, I want to ask at least take one or two questions from Facebook.
Thank you, Bolaji. Thank you, our presenters. We are observing a lot of youth audiences on our social media, both Twitter and Facebook, from Asia and Africa, a lot of countries, I tell you. So I can forward one question from Facebook to both of you. It's from Owen Okoko. It says, how might we help communities where sexuality is taboo to reach their talks about and also encourage more responsibility? I think he meant to say like how can we help a community to talk more about sexuality where sexuality is a taboo. I think either of you can go ahead.
Okay, and in a community that sexuality is a taboo, what we can do is to include all groups in programs. For instance, when we are implementing a project, for instance, we need to invite people. It should be participatory program. Invite all people, young people, elders, community leaders, religion leader, and we need to invite all of them and educate and explain what is the sexuality. And after that, we can. I have mentioned a project of UNFPA, saying that it's a school of husband. This is a innovative project that engages male in promoting sexuality. These people are the leader in their respective community. They can go and promote sexuality, reproductive healthcare in their respective community, so that it shouldn't be seen as a female issue, because there are some people they think that it's a female issue. But by inviting male, engaging male, it can reduce taboo in our societies.
Great, thank you very much. Ephraim, you're on mute if you're speaking.
Thank you very much. I think we want to say thank you very much for our audiences and for our presenters. And we want to share you also how you can join and contribute to our network, to our YouthLead network. If you have not yet joined the YouthLead.org, we encourage you to do so. This will enable you to network with other young change makers just like today and join the discussion groups. As a member on the website, you can also post contents, for example, resources, blogs, short videos, events, and funding opportunities. And you can also post your projects to get more visibility for them. Our YouthLead.org website reached 7,000 members just last week. And for every contribution, you can earn points and also earn badges based on those points. Every month, members also get the YouthLead newsletter, which highlights young change makers like you. You can also follow us on our social media, Twitter and Facebook. And above all, reach out to the speakers, to Anissa and Zaidu, and continue the discussion about the topic in our YouthLead discussion groups. And finally, we would like to thank our various sponsors who are promoting YouthLead to their network, to their YouthLead network, and contribute resources, events, and various funding opportunities. Our sponsors are offering their expertise, knowledge on various topics, and we work with them to organize skill building trainings, webinars, just like today's for our YouthLead members. You'll hear some of them on the future webinars. Finally, thank you very much for joining us. We hope you will join our next webinar, and also check the events on YouthLead.org And also you can check the Facebook and the Twitter page, which we are presenting on the screen right now on the bottom. And as we said in the beginning, the slides and the recording will be made available to all of you on the YouthLead.org website and sent to all registrants. We hope to see you next time. And until then, please stay safe, keep washing your hands and maintain social distancing. Thank you very much for everyone who joined on the live webinar on Zoom and also on our social media page. Thank you.
Thank you very much, Ephraim. Thank you, Anissa. Thank you, Seydou. Thank you all for joining us once again.